Hey you guys, welcome back to my channel. This is going to be a quick video on NCLEX and the number one reason why you're failing NCLEX. The number one reason you're failing NCLEX is your test anxiety. A lot of people suffer from test anxiety. They're not good test takers like me. I have test anxiety. I am not a good test taker. So when I go back and I look at my test, I'm like, dang, why did I pick that? I let my test anxiety get the best of me. What you need to do is slow down. Read the questions more than once. Not one time. Read it multiple times. Take a sheet of paper. Cover up your answers. Do not go straight to the answer before you understand what the question is asking you for. When you get what the question is answering you for, then you can go look at the answers. You need to keep your test anxiety in check. That's the only way you're going to pass NCLEX in 75 questions. That's the only way. Number 2, you know what's in your scope of practice. Do not pick answers that are not in your scope of practice. Like, for example, consent forms. Nurses can only witness consent forms. We cannot get the patient to consent. That's the doctor's job. The doctor has to explain the procedure that is going to happen with the patient. We only witness it. If a patient has a question about the procedure and they feel like, okay, I don't want to do it anymore, you have to refer back to the doctor and get him to come and talk to the patient. Do not do things that are not in your scope of practice because they can cost you your license. Stay in your role as a nurse. We all have a job. Do not do things that you're not supposed to do. Number 2, I used to struggle with select all that apply questions, but simply all you do is read the questions, you write true or false. If the answers coincides with the question, put a T for true. If it doesn't make any sense, put an F for false and mark it out. Do not go back and second guess yourself. 9 times out of 10, if you feel like a question is wrong, it's wrong. Number 3, delegation. If it's something that you can delegate to another person, do it. That's what they are there for. They are there to get tasks delegated to them. But do not delegate a task just because you don't want to do it. That's not fair. And regardless of what, you being a nurse, if you delegate a task and something happened, you are still reliable for what happened. So just don't delegate tasks just because you don't want to do it. Delegate simple tasks that are in other people's scope of practice. Number 4, prioritizing. If you're dealing with patients and they give you a question that asks about patients, think about airway, breathing, and circulation. That's so important. It doesn't matter if your patient has a finger cut right now. It doesn't matter if your patient have a wound right now. If that patient airway is closing up and you did not prioritize that patient first, the answer is wrong. You need to think about airway, because if you don't help the patient's airway, that patient is going to die. That wound is not going to matter. That cut is not going to matter. So you need to think about what is going to save my patient life first. And that's what you prioritize first. Nothing else matters until you deal with that patient and save that patient life. Another thing about NCLEX, you don't have to get every question right. You just need to get more right than wrong. That's how the test is designed. You get more questions right than wrong, you're going to pass. That's the only way to pass NCLEX. Okay, you guys, that's enough time for tonight. I'll be back with another video. Thank you. Please like and subscribe to my channel. Have a good night.